Well, welcome everyone to the Mayor's Institute. We are glad you joined us for this fourth session to the 2022-2023 curriculum. My name is Darian Basin with the African American Mayors Association. And to start our session today, it is my honor to introduce Phyllis Dickerson, Chief Executive Officer of the African American Mayors Association.
Thanks, Darian. Good afternoon and welcome. As CEO of the African American Mayors Association, it is my distinct pleasure to welcome you to AAMA's Mayor's Institute for Racial and Economic Justice Policy. We are excited to partner with the Kauffman Foundation for this year's Institute. This is the third year of the first of its kind Racial and Economic Justice Policy Institute. We focus on critical learning opportunities for mayors and their team. Today's discussion will focus on opportunities flowing out of SAMHSA and that are most relevant to mayors surrounding mental health, substance abuse, first responder training, partnerships in terms of staff and development, as well as what has been done at HHS around mental health, equity and behavioral health, and grant and support programs. And mayors, you know, we like grant opportunities. The presenter for today's session is Dr. Miriam Delphin-Rittmon. Dr. Rittmon is currently Assistant Secretary for Mental Health and Substance Use for the U.S. Department of Health and Human Services and the Administrator for Substance Abuse and Mental Health Services Administration. She previously served as Commissioner for the Connecticut Department of Mental Health and Addiction and served in this role for 6 years. Prior to her current appointment, she was an adjunct professor at Yale University, where she served on faculty for the past 20 years. She doesn't look that old. While at Yale, she served as Director of Cultural Competence and Research with the Yale University Program for Recovery and Community Health. In May 2014, she completed a 2-year White House appointment and working as a senior advisor to the administrator of the Substance Abuse and Mental Health Services Administration and the U.S. Department of Health and Human Services. While there, she worked on a wide range of policy initiatives addressing behavioral health equity, workforce development, and healthcare reform. Through her 20-year career in behavioral health field, she has extensive experience in the design, evaluation, and administrative mental health, substance abuse and prevention services and systems, and has received several awards for advancing policy in these areas. She recently received the 2019 State Service Award from the National Association of State Drug and Alcohol Directors and the 2016 Mental Health Award for Excellence in the United Nations Committee on Mental Health. Please remember to use the chat box feature to ask your questions throughout the session. Without further ado, let's begin. It's my honor to introduce our partners from the U.S. Department of Health and Human Services, Dr. Delphin-Rittmon. Thank you for being here, Dr. Rittmon. Take it away.
All right. Thank you so much, Ms. Dickerson. So appreciate that warm introduction and just the invitation to be able to be here and share about some of the work at SAMHSA and some of the resources and initiatives that we have going on. I'm really looking forward to our conversation and discussion. So I'm going to try to go for about, a little less than 30 minutes or so, give or take, and then really interested in having conversation and particularly interested in just hearing from you all in terms of what you're seeing, what you're experiencing, if there are particular questions you have about any of the resources I share, or other things that may be on your mind as it relates to your communities and addressing mental health and substance use. So again, welcome everyone. I so appreciate the invitation to be able to share. Next slide, please, Anna. So what I'm going to talk about this morning, I'll give us this afternoon now, a quick snapshot in terms of behavioral health and really what some of the current data is showing. Talk a little bit about some of the work within the Biden-Harris administration and particularly the President's Unity Agenda and the ways in which SAMHSA is advancing and moving forward some of that work. And then we'll share a number of different sort of community-related grants and programs for individuals and communities that may be struggling with mental health and substance use challenges. And then I'll end real quickly talking a little bit about some of our initiatives as it relates to recovery-friendly workplaces. And then we'll have time for questions and discussion. One thing I did want to share in terms of a little bit about SAMHSA, just by way of background, we just celebrated our 30th year anniversary, so we're thrilled about that. And our charge is really to address the behavioral health of the nation, to address the mental health, the substance use needs, the prevention needs. And ultimately, I would say our goal is to help individuals and communities and families to thrive. I can say we know certainly the last number of years with the pandemic and even prior to the pandemic, we have seen mental health challenges across the nation. This slide here just shows some of that data in terms of patterns and trends, that we see as it relates to mental health. So for example, recent data shows that nearly 1 in 4 adults 18 or older and 1 in 3 adults age 18 to 25 had a mental illness in the past year. This is data from our most recent national survey on drug use and health. Unfortunately, we still see overdose rates that are above 100,000, and that is just heartbreaking. We know represented in those numbers are our family members and friends and neighbors. And so this is an area that as an administration, we've been really focused on in terms of working to address some of the patterns and trends that we see. And then you'll see some of the other data there in terms of about 52.9 million Americans reporting any mental illness, about 40.3 reporting substance use. We're seeing suicide trends, and unfortunately, which are troubling, 1 death by suicide every 11 minutes, particularly for individuals in the 10 to 14 and 25 to 34 age range. Suicide is the second leading cause of death. And so these trends are really what we are sort of laser focused on working to turn around, to be able to, again, help individuals and communities to experience more positive health outcomes. Next slide, please. So to address, what we're seeing in terms of mental health at the, last State of the Union, the president announced his unity agenda. In that agenda, he mentioned that the administration would really be focused on addressing the mental health and substance use needs of the nation. And ultimately, the goal was to help increase access to evidence-based quality treatment. A goal is also to create healthy environments where people can thrive. And a way to do that is by strengthening system capacity. That is ensuring that systems, healthcare systems, have the resources and staffing that they need to be able to provide quality care. And then increasing connections to care. And we know that's so important in terms of ensuring that people have access and know the entryways into connecting with services. One thing that I've appreciated is that there have been resources dedicated to this. So in addition to putting forward a plan, there have been dedicated resources around addressing many of these areas. And these are just a few examples. So for example, more than $7 billion has been dedicated for our mental health and substance use system in the form of block grants. In addition, about $1.5 billion in terms of our state and tribal opioid response grants. I'll talk more about the opioid response grant in a moment, but that ultimately funds a broad range of prevention, treatment, and recovery services and supports. And then most recently in the bipartisan Safer Community Act, which passed last year, SAMHSA received an additional $800 million to be able to address mental health and needs of communities. So again, these are just a few examples of resources to be able to advance and move forward the president's unity agenda around improving mental health of the nation. Next slide, please. This slide real quickly just shows, the level of funding that we have received. And this is another area that I'm so appreciative of, that in addition to the policy that's put forward, and my light just went off. In addition to the policies that have been put forward, we've seen a significant increase in our funding to be able to support the programs and initiatives that we put forward to be able to address some of the patterns and trends that we see. So you'll see nearly a doubling in our budget from fiscal year 22 to fiscal year 23. And so our current budget is about 10.6 billion. And again, we fund states, territories, communities in terms of addressing mental health, substance use, and prevention, and we do a bit of mental health promotion work as well, which is so important. Next slide, please. I wanted to share a little bit about some of SAMHSA's cross-cutting principles and priorities. These are areas that we're focused on to advance the President's Unity Agenda, areas that we see as critical need based on patterns and trends that we see across a number of different data areas, but they include things like preventing overdose. That is a key priority given the overdose, troubling trends that we see there. Enhancing access to suicide prevention and crisis care, that's also a priority. And I'll speak a bit about 988 and some of our work there that is geared towards ensuring that people are able to speak to a trained counselor. Also promoting resilience, emotional health and wellness for children, youth, and families. Certainly, and unfortunately, we have seen that as a function of the pandemic and even prior, I would say, young people are struggling in terms of behavioral health. And the pandemic in many ways exacerbated that. And we have young people reporting, experiencing the ripple effects. School is back, but, we certainly hear young people talking about it and reporting increased anxiety, depression. And so those are things that we're working on and looking at as well. Integrating behavioral health in primary care. Ultimately, we want to create, greater and seamless integration across physical and mental health care. And then strengthening the behavioral health workforce also is a key priority area. In terms of some of our cross-cutting areas that really undergird a lot of our work, equity has been a long time SAMHSA priority. It certainly has been a passion and interest area of mine, in terms of ensuring that groups have access, all groups, but particularly marginalized or underserved or underrepresented communities have access to quality care that's culturally responsive and is able to meet individuals and communities where they're at. Also, trauma-informed approaches is a cross-cutting principle. Our commitment to data and evidence. I see the data and evidence part is so important because we have to be able to look at the data and evidence to know that our programs are working. And we have to be able to disaggregate our data by key demographics, so race, ethnicity, gender, and age, to see are there particular trends that are suggesting disparities and suggesting, what areas we might need to target in terms of addressing and promoting equity. And then recovery is a key cross-cutting area as well. Next slide. So I want to start by talking a little bit about some of our work as it relates to equity. So we do have an Office of Behavioral Health Equity here at SAMHSA. The goal of the office and mission, again, is to advance equity in terms of our programs, our grants, our policies. Ultimately, we want to be able to increase access for groups, again, that may be underrepresented and underserved. And you'll see the 4 areas of work, 4 priority areas within the Office of Behavioral Equity. There is a data strategy. We're focused on policy. We're focused on quality practice and workforce development. And then also we have a formal communication strategy as well. And that's so important in terms of getting word out about services and supports and the ways in which we're working to engage groups that may be marginalized or not accessing or aware of services and supports. Next slide, please. So I want to talk a little bit about some of the work. Yes, we can make this presentation available and keep the questions coming because I come from a big family and love the conversation back and forth. So, would love to be able to create that community here. So in terms of some of our work specifically with African-American populations within our equity pillar, one area that we're focused on is sort of looking at some of the suicide patterns and trends, particularly for young people. Unfortunately, what our data shows there is, and recent CDC data shows that African-American youth report feelings of sadness It rates over 1.5 times the white population. And CDC data shows that, and actually this is not just for youth, this is overall, but then we have other data that shows similar and corresponding patterns for youth. This next data point here is for youth. But CDC data shows, for example, in 2021, an 8% increase compared to 2020 for young African-American males in terms of suicide mortality. So just, heartbreaking trends there that we're looking at. Next slide. Some of the work that we have to address some of these areas, because ultimately we want to be able to reach communities and let people know about services and supports, meet people and individuals and communities, to include young folks, really meet them where they're at. And so one grant that we have is Project Aware. It stands for Advancing Wellness and Resiliency in Education. And what this grant is about, it's a school-based grant. It provides training for teachers and other school personnel to be able to recognize when young people might be struggling, and ultimately to connect them to services and supports from school. And we know that's so important because our young folks are in school, many hours a week, and often teachers and school personnel are having encounters with them throughout the day. So if anyone can recognize or, it's critical, we believe that the school personnel are trained and have information about how to connect people to services and supports. And so that's what the Project Aware grant is about. From 2018 to 2022, over 200,000 children were connected and referred for services. And so it's heartening to see just a really innovative work that's happening in many of your communities. We have this grant. This grant is being implemented all across the country. It is probably one of our larger grant programs looking at mental health needs of children and youth. Another grant that we have, and we did recently receive additional resources for this, is RECAST. It stands for Resilience in Communities After Stress and Trauma. And a goal of this is really to promote resilience and equity in communities that may be experiencing either civil unrest, community violence, or collective trauma. And we know this is so important because trauma untreated can have ripple effects in individuals and communities and families. So our vision and hope with RECAST, and what we're seeing, in fact, is that communities are putting together, and this grant funds coalitions to work together to be able to identify children and youth that may be at risk, and to work to connect them to services and supports as well. But again, using a community health framework and a coalition-based model. Other work that we have is we also are doing we recently held a Black youth suicide expert panel, and that include young individuals that have been struggling with their own mental health. And it's so helpful to have these types of convenings because often young people can tell us what's going to make a difference, what they feel will help and what they feel will not help. And so we did have and appreciated hearing from young folks about their recommendations. And so I see a question: are municipalities eligible for grants, or is this funding to states? So, many of our grants, it's both. We have some grants that are just for states, and we have other grants that are for community organizations or providers to include municipalities. And for all of our grants, we often recommend, forming partnerships and collaborations across different sectors. And so certainly municipalities we see as important partners in our work as well. Next slide. And so I think what I'm going to do, I'm just going to go till we're going till 1 o'clock, right? So I'm just going to go till maybe half our time, a little bit more, and then we'll just open up the time for questions and discussion. So what I wanted to talk about now is our 988. So this is our 988 Suicide Prevention Crisis Lifeline. This lifeline, it went live July 16th. We transitioned from our 10-digit number to this 3-digit number. And now people can call, text, or chat to 988. If they're chatting, they chat to the 988 lifeline.org number or link. And through any of those three means, they're able to get linked with a trained counselor who can help to just address their challenges and ultimately triage them to whatever services and supports may be needed. And what we actually find is about 98% of individuals are able to have what they're struggling with addressed right there on the call, and don't necessarily need additional emergency support. We will also, though, connect people to services and supports within their community so that they have that information as needed as well. So the thing I appreciate about 988, again, is resources. We've been funded well to be able to expand this across the country. Last year, about $432 million was put towards 988. Initially, when it was the 10-digit number, it was only 24 million. So the administration really is committed and appreciate the resources from Congress around expanding this across the nation. We do have a LGBTQ subnetwork of the Lifeline. We also have a veteran subnetwork, and there is with the state of Washington, currently a tribal subnetwork in the state of Washington that's being implemented. The other thing I want to say about this real quick is that there is a 988 jobs website. Essentially what that is across the 200 call centers across the country, it lists the jobs that are available at the crisis call centers. So we encourage folks, please send this around because there are jobs that are available for individuals to be part of the crisis call center network. They'll receive training for it, and these are paying jobs or also volunteer opportunities if individuals are interested in that as well. Next slide, please. One thing that we're doing is we really want to make sure that the messaging around 988 is culturally congruent. So we're doing a lot around getting the word out around what it is, what it isn't. There were some concerns around, well, does a person, do they have to give their information, or does this mean that they're going to be hospitalized, or does this mean that the police are going to come? And what we're really trying to let people know is that, no, it's anonymous, and that, we're really working on messaging. And so currently are partnering with the Action Alliance and the Suicide Prevention Resource Center, the Ad Council, to be able to work with and meet with trusted messengers and diverse groups to be able to develop messaging that we can use around getting the word out. And so we're really, really excited about this initiative, because I think it's important that people know that this is a resource that is available, that there are trained counselors, that they're attentive to cultural nuance, and that the line is for everybody. Next slide, please. I wanted to share just a little bit about some of the data in terms of the numbers of people that we're seeing that are calling in. So when we compare this past December to December 2021, we see a significant increase in volume. So for example, 172,164 additional calls, texts, and chats came in when we look at this December to last December, an increase by 48% in terms of calls answered, and 263% in terms of chats, and 1,445% increase in terms of the texts that were answered. So again, I'm heartened to know that people are reaching out and they're getting help quicker. The answer rate has gone from 172 seconds, which we know for an individual, if they're in crisis, that can feel like a lifetime, to 44 seconds. And we're working to continue to bring that down. Next slide. Ultimately, our long-range vision, again, is that people are able to, they have someone to call and talk to when they call 988, that there is someone to respond. So we're also supporting, and many communities have crisis response teams that can go out and meet an individual if they're in crisis, and then a safe place to bring a person if they need additional crisis support. Next slide, please. I want to shift gears a little bit and talk about some of our work, addressing the overdose crisis, which we're just seeing such just troubling trends there. Although we are potentially seeing a slight leveling and potentially even a decrease in some of the overdose rates that we're watching really closely. I think it's promising, but nevertheless, we know far too many people are losing their life from overdose. One thing that we're focused on here is implementing the HHS overdose prevention strategy. That strategy has four primary pillars. So one is primary prevention. We know that is so important in terms of doing, community-based prevention work to help for some individuals, like give them information to reduce the likelihood of, they're struggling with substances altogether. So we really are looking to go as far upstream as we can here. And I think the prevention piece of this is so critical. Evidence-based treatment is also a key part of the pillar, making sure and really working to connect people to evidence-based services and supports. Harm reduction is a key part of the pillar, and we recently disseminated a harm reduction grant. This includes things like, we fund fentanyl test strips, and fentanyl test strips will allow an individual to test their substances to ensure that there's not fentanyl in the substance. Often the programs and places that give out fentanyl test strips also will give out information about services and supports. So it's an opportunity to give a person the harm reduction resources, but also to give them information, such that when they're ready and interested in services, they're able to connect. And then the pillar also includes recovery supports. In terms of data, and I talked about some of the data at the top of the talk, but unfortunately our NSDA data, so this is our most recent National Survey on Drug Use and Health, shows about 9.2 million people aged 12 or over have misused opioids in the past year. So this remains a challenge. And when we look at what's driving some of the opioid-related overdoses, we see fentanyl is largely implicated there in terms of the overdose deaths. In terms of some of our programs, and our time doesn't allow us to go into all of these, but, these are just a few examples. And again, I can make these slides available. Our big grant is probably our next slide, and next slide gets it, one of our larger grants. Our state opioid response grant and our tribal opioid response grant. And typically the states will fund community organizations, and many partner with municipalities as well around some of the work that's happening through the either state opioid response grant or tribal opioid response grant. One thing we found when we looked at the data is 26.3% increase in individuals who have participated in programs or services from this grant, reporting no alcohol or illegal substance use within the last 30 days. We also find that when we look at our data that naloxone, and this is a real priority for us, that is disseminating naloxone far and wide. And again, naloxone is an overdose reversing medication. So for individuals that have that are in the midst of an overdose, naloxone is literally life-saving, and that it can reverse an overdose. And we see this across the country. So when we look at our SOAR data, we see that about 6.5 million naloxone kits have been purchased. About 6 million naloxone kits have been distributed, and about 791,000 fentanyl test strips have been distributed. And so increasingly, we're actually working with states around, saturation. So naloxone saturation, that is saturating communities, with naloxone, again, through our state opioid response grant resources. Next slide. And then in terms of the number of overdoses reversed there, you see 379,000. Just looking at our time. Okay, so I want to talk a little bit now about, some of the workplace well-being, work that's happening across administration. So most recently, the Surgeon General, put together a framework and disseminated a workplace well-being guide and document. And I think that is so helpful in terms of being able to lay out a framework of ways to think about workplace well-being and ways to intervene in terms of the workforce around.
One thing I wanted to add or ask is this.
Around.
And everybody mute their phone. Thank you.
Thank you. Around overall well-being. The U.S. Department of Labor has an initiative that's currently underway called, and we've partnered with them on this as well, recovery-friendly environments or recovery-friendly workplaces. And there's some resources at the end as well related to this. Recovery-friendly workplaces and environments are so important for individuals that are in recovery and working in workplaces. What it lets them know is that the workplace and the environment supports them. And so some places will have AA groups at lunchtime, or will offer information to employees regularly about EAP or about recovery. Some places will even put signs on their door that this is a recovery-friendly workplace. And I think the messaging that sends to an individual that may be in substance use or even mental health recovery, many people say that it helps them to feel valued, and that they don't have to be invisible or feel invisible within a workplace setting, and that they feel supported. In terms of some of the Surgeon General's work, the Surgeon General in his most recent report talked about how about 76% of US workers have reported at least one symptoms of either mental health or mental health condition of either anxiety or depression. And that's a 17% increase over the last 2 years. Also, about 81% of workers reported that they'll be looking for workplaces that support mental health in the future. So people are interested in their workplace supporting overall wellness and well-being. And then 84% of respondents reported that, at least one negative impact on their mental health that occurred within a workplace setting. Next slide, please. This slide here presents the Surgeon General's overall framework for mental health and well-being. And there's 5 overarching domains of this, including protection from harm, connection and community, work-life harmony, mattering at work, and opportunity for growth. And you'll see within each of these areas, there are key areas or key features within that particular domain. At the bottom here on this slide, you'll see there is a link to this resource as well. And so I did just want to draw people's attention to that. Next slide. This is more information about the Recovery Friendly Workplace Initiative. Again, U.S. Department of Labor defines a recovery-friendly workplace as one that has policies and practices in place that essentially expand employment, that inform employees about mental health or substance use related resources that reduce risks, that ensure and facilitate access. And there's a link there at the bottom to more information about Recovery Friendly Workplace Initiative. Next slide. I think that might be. And these are some additional, again, just resources for recovery friendly communities. So it's a whole initiative that is really beginning to expand out. We have Recovery Friendly Workplace, and now from the recovery friendly community work, what we see is that municipalities and other sort of local officials are putting information on their websites, letting people know that, look, we're a recovery friendly community, and then listing out the resources and offerings and opportunities they have for individuals that may be in either mental health or substance use recovery. They let people know where and how they can get Narcan, for example, or where and how they can access treatment services and supports, or where and how they can get support from a workplace perspective. And it really serves to destigmatize mental health and substance use challenges. And so I believe is my last slide. Yes. So again, thank you so much, and really just appreciate the opportunity to be able to share a smidgen of what we have going on. But looking forward to any questions or comments that you all may have. So thank you again for the invitation.
So thank you, Dr. Whitman. We have quite a few mayors on the call. We'll let them raise their hand and Darian will recognize them. But while they're trying to articulate their questions to you, I do have a couple that I wanted to ask.
Okay.
The culture, sometimes the word mental illness has a stigma to it for us. Can you define, because I'm not sure that we actually know what mental illness is. We have relatives and we say, well, some ain't quite right with him or something. wrong with her, but we don't ever say the word mental illness. And so define for us from a healthcare provider point of view, what that really means.
Yeah. Yeah, it's such an important question. And it's a nuanced and in some ways complicated question. I mean, there is often when a person has a mental illness, it really interferes with their daily functioning and ability to function in day-to-day life. It means that they're perhaps experiencing increased distress. It might be increased anxiety or increased depression. The person may be having thoughts of harming themselves, or the person may be hearing voices or having sensations that they're not able to explain, or they may feel excessively sad or excessively high energy. So individuals, for example, with bipolar illness may experience a phase of mania in which they're not able to sleep, and they're have super high energy, and sometimes associated with that is trouble concentrating, or trouble with making judgments that are healthy and appropriate. But in terms of an overall, like super high level definition, it's when an individual experiences a high level of distress that interferes with day-to-day living, and may interfere with their relationships, with their work, with their ability to be sometimes take care of themselves or care for others in more extreme cases. That's a high level definition. But then there is also a formal classification guide that lists probably over 30 or more, upwards of 50 or so different specific mental illnesses that a person could have.
Perfect. And you talked about some of the funding opportunities. And as a former mayor's chief of staff, I know we always want to know which one of the funding opportunities go directly to the city. And so are there specific ones? Because as you know, we have blue cities and red states, and we don't always see the money. Mm-hmm. And so can you kind of articulate what comes to us?
Yeah. So it varies. So, we fund the state opioid response grant, for example. Many states have partnerships and work with cities or their health departments. So those are flexible resources that states have to partner and that can fund municipalities as well. Same with the block grant. The block grants go to the states, and often those fund communities and municipalities. Municipalities can apply for our discretionary grants. So particularly if they're in partnership with other community-based organizations. So it might be, for example, RECAST, the grant that deals with addressing trauma, collective trauma, and well-being from a community perspective. That grant often involves municipalities, and the applicants to that often include municipalities are often included in that, as an overall initiative, since it takes a coalition-based approach at the local level.
All righty. And mayors, remember, you can raise your hand if you have a question. If not, I'm going to keep going. So you brought up those test strips. And one thing I have found out over time as it relates to the test strips is that some states have banned them because they think if you bring the test strips in and allow young people or people period to use them, it increases their use of drugs. And so is there policy that you guys are looking to push to make sure that all of our states have access to that?
It's a really good question. And before I answer that question, I do want to draw your attention to the chat. Anna Hancock, you'll see has put information about our grants. And to that point, I do want to encourage folks, check out our website regularly, because we give out so many different grants, and the eligibility varies based on grant. And so there are some certainly that municipalities could apply for and be part of community partnerships with applicants that are applying. So now I'll go to your question, because I appreciate that. Harm reduction. So fentanyl test strips are part of a harm reduction approach. They are a harm reduction strategy. And we know that there are, unfortunately, there is still some misunderstanding and even stigma perhaps around that. We believe that harm reduction is vital to keeping people alive and ultimately helping them to potentially be able to connect with services and supports and, ultimately move into and achieve long-term recovery. We though can't dictate state law. So at the federal level, our grantees are able to use federal funds. This is new, and it's something that the administration, certainly that I am very much in support of, that is part of the overdose prevention strategy. So our federal funds can be used to purchase fentanyl test strips, but of course it has to align with what's happening in terms of state law, and so that. There are limits to what we can require and push there.
Okay, so it's not like the Narcan where everybody can get it. It is still some restrictions as it relates to certain states.
There may be. In certain states, fentanyl test strips may be viewed as paraphernalia or classified in some other kind of way. There are, I believe, a few states where they're not allowable.
Okay, and next, as it relates to that 988 call center, we kind of did some PR stimulation on it last year in our newsletter to make sure the mayors knew about it. But one, what kind of data collection do you do in the center? And then two, is that information disseminated to the mayor so that they kind of have an idea of what's going on in their city? Because what I think may be happening is on you guys in the 988 centers, and you are collecting data, but then the mayors don't have a clue. And so they don't know that there is an uptick in suicide thoughts or things like that. And the reason I say that is because at my church in Little Rock, I was there one day and our youth pastor said, if you have been considering suicide, come to the altar. And the people that came to the altar were the elitist, upper middle class girls, pretty girls on the drill team, the cheerleader. They were not anybody we expected. And it was probably 50 young ladies that came to the altar. And so it's not the stereotypical person that you may think of. It's totally different. And sometimes I think that the mayors are dealing with 50 different things and trying to juggle it. And so that sharing of that data could definitely help.
Yeah, we should definitely keep in contact. I think this is something we can partner on. We do currently look at data by state, but it certainly can be further disaggregated. We don't collect personal identifying information because we want people, and it's important for people to feel safe and to feel that their information is confidential. But we do collect, high-level information around perhaps some of the content of the call, real high level information there. But we don't, but no, again, identifying personal information is collected. But we can likely disaggregate the data further. So we have it by state, disaggregate it potentially further by municipality to be able to look at some of the patterns and trends there. Perfect. So we should keep in contact. We should keep in contact about that.
Thank you. Mayor Sean Howard from Mount Vernon, New York has a question.
I think Mayor Robinson had a question first.
Oh, I'm sorry. Mayor Robinson, you're first.
It's all good. Peace and thank you for your time. Quick question, Doc. I hear a lot about, what seems like to me 3 steps above or past where my people are. I mean, if we're considering the lessons from Maslow hierarchy needs about people who don't have their basic needs met, the per capita income in the town that I serve is about $13,000, and people are struggling, to say the least. The poverty rate is over 30% and has been there since before my life. So, I mean, this conversation about addressing mental health is 3 conversations past where we are. Are there any resources that you will offer that tackles the epigenetics of trauma that's passed down for, let's say since slavery, and and everything in between now and then? And if so, how do I access those resources?
Yeah, no, I appreciate that question. And it is important to be able to address the nuances and to be contextually, to have the services and the conversations and supports match the context. Recast is potentially one, one grant that could be of value there. That one is focused more on sort of individuals or communities that may be at risk or may be struggling. That one is focused more on, there is trauma, collective trauma, civil unrest, or community violence. And so that's one sort of pocket of resources. It's a possibility. There are other grants, for example, the Project Aware, and, to the extent that the community, where are you again, did you say?
I'm in Eastern North Carolina. I'm the blackest town in Halifax County, and they tend not to offer resources to us on a regular basis. And I've also pissed off my governor because I tore down a Confederate monument. So the state's not helping either.
Okay. Project Aware is another, I think, grant that can be helpful for identifying young people that may be struggling. And I think that is one where we see people across the nation being connected, to include in underserved and underrepresented communities, being connected to resources and supports. I don't know if your community has that in North Carolina, if you have a Project Aware grant, but certainly as we're approaching grant season, I encourage you, certainly everyone, check out our website regularly, and connect with community organizations that might be a good fit for many of these grants, because ultimately it can help to address many of the areas that you're talking about.
Thank you.
Yeah. The other thing too is as I'm thinking about it, because I was a state commissioner prior to this role for 6 years in Connecticut. The block grant that is flexible resources. And so states will often partner with municipalities. If you have a project or program idea, that's the other thing. There might be opportunities to, sounds like what you'd mentioned, there are some tensions there, but sometimes partnerships with other community-based organizations that are either funded by the state or directly through some of those flexible resources. We've seen real creative, innovative, culturally focused programs being implemented there. So,
Mayor Sean Patterson Howard, Mount Vernon.
Good afternoon, and thank you so much. I was doing it from my phone. I was actually on another Zoom with a mental health organization who was looking to build supportive housing in Mount Vernon, and comprehensive supportive housing. So I was like, we're dealing with mental health and substance abuse at the same time on both Zooms, but I was able to take notes and hear. So thank you so much for having this conversation. I think before COVID, and definitely since COVID, we understand the importance for a comprehensive continuum of behavioral support services for our residents are critical. Our young people are returning to schools that are much more violent than they were before they left for COVID, because there was lots of isolation, but even more so, a lot of time spent on social media talking trash. And now people are cashing in the wolf tickets that were given when kids were at home isolated. And so much more anxiety and mental health amongst not only the students, but the parents. Here in New York, and I know other places, the level of alcoholism went up. The fact that cannabis is legalized and we're opening dispensaries in more states does not take away the legacy market. And so, your 14 through 21-year-olds who are still engaging heavily in the legacy market around cannabis, that number is real and growing. And the introduction definitely of fentanyl into those things makes it really, really challenging. And so harm reduction is definitely the way to go. When we're talking about the fentanyl strips, years ago around the AIDS crisis, we were opening up needle exchange programs. And needle exchange programs had some of the same challenges. Is HHS looking and SAMHSA looking to kind of duplicate and replicate what they did to get needle exchange more accepted throughout the nation and different states? Are they using that similar approach to address the availability of fentanyl strips? Because I think it's important.
Yeah.
It is important. We don't want young people or older people to overdose accidentally. And as excited as people are about the cannabis industry becoming legalized, the cost for, you know, $5 nickel bag on a corner and $5 in the store is going to be very, very, very different. And so I think the legacy market is still going to prevail. And that's where you're going to really, really run the risk of fentanyl and other things being mixed in and causing these challenges.
Yeah.
Those.
Yeah. Yeah. I mean, I appreciate your comments and, you know, the challenges are significant and, you know, it is a strategy and a priority within HHS to continue to advance the harm reduction as a strategy, to include strength service programs, to include programs that disseminate naloxone, you know, Narcan or fentanyl test strips, and other harm reduction approaches. We did recently award 25 grants, harm reduction grants across the country. We're looking to continue that initiative, but certainly a goal is to continue the work around supporting people and really meeting individuals and communities where they're at. And I think that's some of the strength and value of harm reduction, that it lets people know that, you know, you know, we want you to be safe. We want you to be safe, and but also there are services and supports available, you know, if and when you're ready. And so that is some of the work that is happening around the harm reduction initiatives.
So I jumped straight from needle exchange to the fentanyl strips, but when we're talking about Narcan, Narcan seems like it's become much more widely accepted throughout the country, and probably definitely in those opioid communities, which tend to be more conservative in the first place, right? You know, the West Virginias. No. Unfortunately,
what we're seeing with the overdose crisis is that it is all communities. It's not, it is all communities. It's in fact, we're seeing currently our most recent data shows the greatest increases among African-American communities and Native American communities. Okay. But even with that, though, it is all communities are being impacted. And we're also seeing younger individuals being impacted as well. So 18 to 25-year-olds, that's where we see certainly one spike area. But then it's really across the board in terms of demographics, in terms of race and ethnicity, and also in terms of economic status as well. It's truly all communities are impacted here. In part, it's because the fentanyl is highly addictive. And it's easily accessible. People can get it online. They can get it all kinds of places. And so it is a highly deadly substance.
So the communities, because Narcan has been really widely accepted by the criminal justice community and, police departments, suburban, rural, urban, Republican, Democrat, they're using Narcan. And, I don't think after they administer a dose of Narcan that they're then arresting you for the drugs that you have in your system, knowing that you kind of just got high. So again, how were we able to get Narcan into some of those more politically conservative and less focused on treatment communities? And could that same approach be used for the fentanyl strips?
Yeah, it's an important question. I think one thing that has driven a lot of the even areas that are sometimes more conservative to expand and take on some of these approaches are the deaths, unfortunately, which is truly heartbreaking when you hear some of the stories of the ways in which community members and our family members and our friends are being impacted here. And so there are laws. Many states have passed laws that that if Narcan is used, or if a first responder is called, to save an individual's life, and there's opioids or an illicit substance, that it will be not about arresting the person, but about connecting them, about saving their life and connecting them to services and supports. And many states have laws to that effect, that the person will not be arrested unless it's a scene where they come on the scene and it's clear, like it's a lab. That's a different scenario. But often states are taking save the life first and connect the person to services and supports. And that often is the approach. And there are Good Samaritan laws. Many states now have Good Samaritan laws as well. That, if I'm with a friend and their friend overdoses and I call or I help, I'm not held liable if the person overdoses, or if the police comes and I'm there at the scene and there are substances at the scene, there aren't repercussions for me or for the individual that calls. Many police departments are saying that and certainly an approach. We're partnering with Bureau of Prisons and others. We can't arrest our way out of this. That many communities and individuals are truly struggling, and to arrest an individual doesn't help them achieve and move into recovery. So in fact, we're partnering with prisons and jails across the country around offering medication-assisted treatment within prison settings, to be able to. So if an individual is in a prison setting and they have opioid use disorder, it's important that they are treated for that, such that when they are out, that they don't go back to their regular use. It makes them vulnerable for an overdose if they go back to the usage levels prior to being arrested.
Is there any appetite, only because I don't see hands up, is there any appetite with HHS to potentially partner with AAMA around mental health first aid? Really, because mental health first aid is big. And, in our, amongst our mayors, we've been talking a lot about co-response and alternative response to police departments. And so, we've been looking and talking to DOJ about funding, but most of these co-responses or alternative response teams are really behavioral health focused. And so is HHS really starting to dedicate more money towards those type of initiatives as well?
Yes. So in fact, through the bipartisan safer community resources that I mentioned earlier, we did receive additional resources for mental health awareness training. And that's a fairly large initiative that is now larger, based on the need that there is a strong need for further mental health awareness training for first responders, for just across the board, school personnel, municipal personnel, really across the board. And so again, go to our website regularly, because I'm pretty sure that the mental health first aid one is that one's pretty broad in terms of eligibility for that. So definitely go to our website regularly. We're approaching grant season, and so soon you'll begin seeing, many of the we call them NOFOs, notice of funding opportunities. And I believe we did put a link to that in the chat as well. There's also a link in the chat that has a report by state for some of the Lifeline, the calls and chats and texts into the Lifeline. So that is available online as well. It's not disaggregated by city. That is a further analysis that would have to be done, but certainly that data is there.
Thank you, Dr. Rittmon. Darian, can you close this out?
Yes, thank you all for joining us today. We have recorded today's session and we'll make it available online. Special thanks to our partners, the Kaufman Foundation and Dr. Delphin-Rittmon, for making this session possible. And stay tuned for our next February session in the coming days. And thank you all for joining us.
Fantastic. Thank you. Thank you again for the invitation, and thanks everyone for joining.
Thank you.
All right. Take care.
Be well.
Bye.